Hi, I'm Sandra, and today we're here to talk about preventing sore nipples. Pain on day 1, a little soreness by day 2 that starts to improve by day 3 or 4. Severe pain with latch, cracking, and bleeding are not normal and require a lactation consult possibly, or some assistance. I think that one of the things that's very important is that as soon as possible, you figure out what is causing the pain with latch. What is the origin of the pain? What you don't want to do is start bottle feeding and pumping instead of latching, and you don't want to go to a nipple shield until you've taken the time to truly try to target what is causing the pain with latch, and then trying to fix that before moving on to the next solution. Because if it hurts on day 1, it's only going to get worse on day 2, day 3, day 4. Oftentimes when a baby is not ready, they don't root, they don't open their mouth for you, their tongue is up blocking the breast from going all the way in, therefore the breast doesn't get in above the tongue and deep enough to trigger suck, either too sleepy or possibly hungry and crying already. So when it's too soon, the baby won't root for you. When it's too late, the baby's already crying. At that point, you kind of have to stop, calm the baby, and start over again. Another thing that could be causing a big problem is just the shape of the breast versus the shape of the nipple. Say mom has really large nipples and it's hard to get the baby's mouth around it, or maybe mom has a very flat nipple or an inverted nipple, and it's causing a problem with latch and causing the baby to end up right on the tip of that nipple, and that's causing cracking or pinching. Oftentimes the baby could have neonatal teeth, and it is true. Sometimes babies are born with teeth, and that can make it a little difficult to latch. However, that can be accommodated as well once you realize what's causing the problem. Sometimes it just has to do with the positioning of the baby. So oftentimes the position of the baby is very unstable. And because the position of the baby is unstable, it's actually causing the baby to slide and move around. So even though you've taken the time to properly latch the baby and get the baby in a good position, because the baby's legs are dangling, right? Or because mommy's feet are not on the floor, or because mommy's sitting right on the edge of her couch trying to latch the baby, or because when she latches, she changes position, and that causes the baby to slide down to the nipple. So it's very important that mommy be in a very stable position, feet on the floor, on a footstool or an ottoman, and the baby in a very stable position. Say this is a cradle position and baby's legs need to be stabilized. Maybe with the boppy pillow or the way that mom's holding the baby. If baby's in a cross cradle position, the legs are very unstable unless your pillows are really good and mommy's in a very stable position. Even in a football position, you don't want the baby to be sliding once the baby is latched. You want the baby in a stable position so that the baby will stay there once the baby is latched to breastfeed, rather than sliding down to the tip of the nipple, because unstable positioning definitely causes sliding, and sliding definitely causes pain with latch. The way that they choose to hold the breast sometimes is what we call a V hold or a cigarette hold, where a mom uses her 2 fingers to hold just past the nipple. Unfortunately, you can see how that hold will cause the baby to get right to the breast because the fingers are in the way. We would prefer or recommend more of a C hold or a U-shaped hold with fingers away from the nipple and areola. That way the baby can get deeply onto the breast. Oftentimes moms will feel as if their babies can't breathe, especially women with larger breasts. They're very concerned about their babies breathing during latch. So they tend to take their finger and pull back their breast away from the baby. However, when you pull back away from the baby, you're actually pulling the breast out of the baby's mouth, versus if you were to just point down, that way the nipple will stay deep inside the baby's mouth, the latch will maintain. However, you can give the baby more breathing space by this instead of actually pushing back away. So that's a big problem. And then of course, one of the huge problems that causes pain with latch is unidentified oral cavity issues like low-level tongue ties, bubble palates, really high palates, really low palates. Things of this nature can definitely cause a problem with latch, where mom can have a lot of pain, a lot of cracking, a lot of bleeding, and oftentimes these things are not identified initially. It may take weeks or a month before someone actually realizes there is a problem, and everything that mom is doing to try to combat that problem is so far not working. So this is something that definitely needs a consultation. If you get weeks later and months later after trying everything you know how to do and you still find that there's pain with latch, you may want to look into an oral cavity issue.